Jerry came to us basically as sort of an emergency phone call. I still remember the day pretty vividly. He was very sick, and he was in a condition that we call cardiogenic shock, which basically just means the heart is failing so badly that all of the other organs in the body are at risk of also failing.
Well, I just couldn't breathe. And I knew that I was in trouble, so I was down on the floor, but I got to the phone to call the front desk. But the next thing I knew, I was at KU.
We knew he was coming, so we had about an hour and a half to prepare our team. And we had a surgeon, an interventional cardiologist, and myself essentially ready when he showed up in our ICU. We had to decide what we were going to offer and how we were going to do it. And so it was a true heart team discussion, a true multidisciplinary discussion, which allowed us to bring kind of the best minds for each domain involved in his care to come together and come up with the best plan for him and his family. The first step was to get him out of shock and rescue him from that. And that involved having Dr. Tadros insert a device called an Impella, which is basically like a vacuum cleaner to be inserted into the left ventricle, the main pumping chamber. That allowed him to be more stable and to get through the other procedure that was coupled to this, which is basically implanting a stent in the front artery of the heart, called the left anterior descending artery. And what's different about this is oftentimes people will deploy stents for patients having a heart attack, but it's much harder to do in a patient who's dying actively. And so the pump allowed him to get through the procedure and recover, and the stent allowed him to actually get blood flow going back into his heart again. Tying the device therapy to the medical therapy was very instrumental in his overall care and allowed him to actually leave the ICU and leave the hospital and be on the path to recovery.
I feel great. I really do. Each day it seems like I feel a little better. I work most days. Some days I work all day. If I get tired, they tell me just take a little nap, and I like naps. But I do feel very good. I do have a big joy in my heart about the fact of being at KU and also being cared for by KU people who really make me feel special. And I think that's one of the great things about the hospital, that you're just not a patient, you're somebody special, and they want you to have a great life, they want you to have a great lifestyle, and they want you to live a long time if that's the Lord's will. And I feel special in that area.